There are things that you did in your 20s that you regret today. I'm only talking about skin right now in a podcast.
I spend more time moisturizing myself than I do like getting ready.
You introducing a sunscreen, don't think you are protected. You're still damaging your skin, but maybe a little lesser.
After the first film, I had terrible acne. I think it was to do with my mental health. It came onto my face as acne.
Everybody now is on social media and everybody is learning through social media.
Overloaded knowledge. Skincare has now become a little more trend-based than more science-based.
You wake up and you look at yourself, somewhere you feel like there's something wrong with you. How do I combat this? How do I go to work? How do I meet people? Because you have to look your best.
The faster we start taking care of our skin, you will be preventing hyperpigmentation.
Oh, before you start aging, you should get a little bit of filler or like Botox is very good. And I have come for a very different conversation.
Freckles, but now people are very into freckles after Alia Bhatt having natural freckles. It's desirable.
How do freckles come? They are photo damaged, right?
Right. You tried any home remedies?
What I have tried is dahi, a little bit of besan and haldi, tinge of honey.
I agree to disagree with everything that you all have spoken. Your kitchen stuff is to consume, not to apply. What is your skin? It's a barrier. You don't want to disrupt that.
Now people use those light masks, red light, blue light.
Like I said, everything trending is not science. So everything in our body goes to degeneration, right? Your nature doesn't want you to live beyond menopause.
I actually had terrible pigmentation. It was like a mask.
When the world comes to an end, two things which will never go, cockroach and melasma.
So I feel that there are three kinds of people when it comes to skincare. One, who really look after their skin. Two, who really doesn't look after their skin or pay any attention to it at all. And then there's a third, people who are doing skincare, but just maybe not the right way. And this episode is especially for this third category. And also for anyone who is currently dealing with pigmentation especially, because it has become a rising concern for our skin type in India. Most of us, we think we're taking care of our skin, but what if the biggest damage we're seeing today actually comes from habits that we picked up years ago? This episode is supported by Eucerin, the first ever dermo-cosmetic brand. Eucerin is a globally renowned dermatological skincare brand known for its clinically proven, science-led approach to treating concerns like hyperpigmentation, acne, and sensitive skin. Hello and welcome to All About Her, and today we're discussing skincare sins and pigmentation. And to explore this, I'm joined by two wonderful women today. So joining me is someone for whom being in front of the camera is a huge part of her life, and where your skin, in many ways, I think, becomes an extension of your work. She's an incredibly talented actor and someone that I've always known to be incredibly authentic, real and honest, and also a very dear friend of mine, Anya Singh.
Hello.
Thank you for being here today.
Of course.
And we also have someone to guide us through the science behind all of this. A renowned dermatologist who specializes in treating all kinds of complex skin concerns, including pigmentation. Known for combining clinical expertise with a very personalized, compassionate approach, Dr. Farida Modi.
Thank you for having me over.
Thank you both. Both of you are looking lovely and well rested.
So are you.
Thank you. I thought that the reason why, I should explain why we have Anya on the show, is because you were recently in your 20s.
Yes. Thanks.
More recently than me. That's the only reason.
Yeah.
And perhaps there are things that you did in your 20s that you regret today. I'm only talking about skin right now on this particular podcast. Other things we leave for
Later.
off camera.
Yeah. Or another show.
Or another show, whenever you want to share. But perhaps those decisions also impacted your skin.
Yes.
And perhaps there are mistakes that you made that may have started to show up now in your 30s. You've just entered your 30s. And then apparently in your 30s, and of course the doctor will tell us, in your 30s and especially your 40s, a lot of things start to become more apparent. Let's start though with the beginning of, do you have a skincare regimen, Anya? And can you sort of take us through that? Like what you do for your skin on a good day?
on an everyday basis.
I don't know, are you very disciplined? Do you do it every day?
I have a very simple routine. So I think for me the simpler something is, the more I will follow it.
Yeah.
Because if there are 10 things to do, I'm just going to get lazy and like sit back. So I cleanse my skin, of course, and then I moisturize it.
Very good.
And then I'm done. No, but I found every time I watch these reels where people are doing, like very recently, I don't know if you've seen them, people wake up and they have something on their hair, and then they have something on their lips, and they have like various masks, and they take it all off. And I'm just like, wow, you look amazing, but I could never sleep like this. I would be so uncomfortable wearing 10 layers of various plastics on my face and then going to bed. So I get very overwhelmed watching people do so much for their skin. And I think because I have extremely sensitive, hyper-allergic skin, for me, less has always helped me. So when people ask me, oh my God, what do you do for your skin? I most often use coconut oil to sort of clean it or hydrate it if it's very dehydrated, which it is most of the time. Very simple. By simple, I mean cleaner products, less chemicals, and easy on my skin, more breathable.
Before I come to you, Doc, I wanted to ask you, were you always aware of, for example, do you know your skin type? And like you said, dry, but people have combination skin, oily skin, acne-prone skin. So do you know your skin type?
I think I've learned by interacting with my dermatologist over the years. Also, your skin does not behave the same way in every weather. So if I'm in Bombay, it behaves a lot nicer to
because
me
of the humidity.
because of the humidity. The moment I go to Delhi, my skin is automatically like 3 times drier. If I go further north, it's even more dry. If I go to London or any other place which is cold, my skin is not kind to me, but it gets really dry and itchy. So I spend more time moisturizing myself post my shower than I do like getting ready and doing all these various steps to get ready.
Yeah, it's true. Everybody now is on social media, and everybody is learning through social media.
Yes.
There's people that they follow, they may have credibility, they may not, but they become popular, and then they show up on your reel, and people are trying. I think especially when you're younger, you're on social media perhaps more, and you really believe and you follow and you're open to experimenting. So I wanted to ask you from a professional point of view, whether you think that this generation is perhaps doing more harm to themselves or good by following some of these skincare trends.
So like it said, everything has two sides to the coin, okay? So social media, so I've started my practice since the last 25 years, and when we started practice, we really had to sit maybe for half an hour, 1 hour to explain to our patients why their skin requires a basic care, like you said, just the right kind of cleanser or the right kind of moisturizer that you start using. But thanks to social media, certain things now we don't have to waste our time. They come with ready to start taking care of the skin. They are more proactive, okay? But of course now what I feel is in social media you have too much of overloaded knowledge, and sometimes, like you said, they are not true knowledge. So I think skincare has now become a little more trend based than more science based, and that's I think where experts like us would come in, and we would really like to tell our patients on what is the right products and how to be used.
And also, I think they sell it so well, right? Everything looks so pretty and everything looks so, oh my God, the packaging is so nice. And you buy it without realizing if it's for your skin type or not, if it's beneficial to your skin or not. But I myself have been a guinea pig to so many of these reels and been like, oh my God, this looks so tempting. Just the packaging of it is
and
so
the
nice. And I'm like,
and the marketing,
I want it.
So recently I had one patient of mine who was traveling, and she got a cream which was worth 50,000 rupees. And of course she got bad breakouts with that. And then I would tell her, why would, if you are
because she was so stressed about it, spent so much money on this cream.
But always what is expensive is not good.
Not necessarily.
So, not necessarily. So it all depends on, the right kind of products that you're using.
And there's actually a lot, because sometimes, because it's the marketing and the packaging, as you said, and sometimes they spend so much money on doing all of that, whereas you can get an equivalent product that doesn't cost so much, maybe from your local chemist even sometimes.
Yes.
Absolutely, absolutely.
What is, according to you, the most overrated trend?
Korean glass skin. I think that is one of the most overrated thing, where people have suddenly started layering their skin with multiple products containing too many actives, thinking that their skin will become completely so-called even toned, even texture. Okay, and I think there's nothing like a glass skin. Okay, and most importantly, it's so relevant to customize what you're using. Like you asked her earlier, did you find out what your skin type is? And that's very important.
Yes.
Though we're saying the base of your skincare is your most relevant CMP, cleanse, moisturize, protect. If you're doing that, you've at least started with the main core first line treatment. And that's very important. To build a good skin barrier, what is your skin? It's a shield, it's a barrier. You don't want to disrupt that. And you definitely don't want to disrupt that with too many actives. So moisturizing, you are there. Okay, you have to first basically build up on your barrier. And the second most important thing, protect.
I don't think she's quite there with the protection.
Yeah,
Why
so you need
sunscreen?
that. Yeah,
You didn't mention sunscreen.
I went-
You just said I wash my face and then I cleanse, I hydrate it.
By mistake,
And
I
that's
told
it.
you my night routine. I should have started with my day routine. In the morning, I always use sunscreen.
Okay, so you're there.
Okay, so you're there.
Your core is there.
Thank
We'll
God.
build up
But
on
there's
that.
more.
There's more. We'll build up on that.
There's
yes.
always more. I've known you for a few years now.
Yes.
I actually feel like I've seen an improvement in your skin in recent times. Now, I know that you started working in films when you were 24, 23, 22?
24.
24. Do you feel like when you started working in films and you saw yourself on the big screen and you started using products and makeup, is that when you started looking after your skin if you did, with more discipline or more awareness, or was this something that you had done prior to joining films?
I would say genetically in my family, touch wood, everyone has good skin. So when I came here, I don't think I was somebody who even knew much about products or what one should use. I didn't know anything about makeup. I didn't know what basic moisturizers, whatever suited you, I would use it. And my nanny has always been a very simple, like she had this Charms.
Yeah.
Charms.
Charms, yes.
For years she used that. Then it was Pond's, you know. And I just saw the same set of 5 things in her dresser and she would use the same thing all the time. So in my head I was like, okay, this is how it works. I came to Bombay. I also went to a boarding school where makeup, getting ready, grooming yourself was not really a priority. We didn't have like salons or waxing didis or anything. None of that was really...
apparently.
None of that was allowed, though today now in my school it is. But back then this was not given priority. It was go out, play sports, debate, learn a dance, learn an instrument.
I mean, yes, it was a school.
It was, but I mean, if in more urban cities, the girls around me were much better groomed. You know, they had already started visiting doctors or dermatologists or like salons and getting like nice haircuts or like at least like waxing themselves. We were just like walking around. Anyway, doesn't matter. When I came to Bombay, I didn't know anything. It was only when after the first film, I had terrible acne. And I still don't know how it came about. We were chatting about this before we started the podcast. And I think it was to do with my mental health. I was in a very bad space at a personal level. And I think when you're holding on to so many emotions and it doesn't have a form of release, it just it came onto my face as acne. That is when I started taking care of my skin. Also because people around me were like, it is important for you to do this. This is your profession. And I became extremely underconfident because on a normal daily basis, you've seen I never wear makeup.
No.
And neither do you actually.
Yeah.
So to constantly mask this and find ways to hide it, either with my hair or layers of makeup, it made me very uncomfortable and uncertain of myself. And my personality is one where I like to just be who I am and walk around without makeup because that's just the person I am. So I learned that this was really messing with my mental health further because I was
Of course, yeah.
Every time I went for an audition, every time I went for a meeting, I was always so conscious of myself, and instead of paying attention to the conversation, I was paying attention to how to hide this acne on my face. And I mean, kudos to people who are so confident with their acne. It can really pull you down.
Yes.
That was the time when I started to take care of my skin. Exercising, I think, has been a huge part. If you're saying that you've seen a change in my skin over the years, it's primarily, I think, because of eating a lot better and exercising.
Yeah. Perhaps less chips.
Yeah, I still eat a lot of chips, but I'm trying.
So you're so right. Most of the disorders, let's not call them disease. A disease is something that you get because of a microorganism attacking you from outside, right? A disorder is your own body's tendency, okay? And most of them are psychosomatic. Soma is your body, psycho is your mind, okay? 80% of medical disorders are psychosomatic. So they all originate in your mind, and that is how it manifests on your body. And every body has a different way of manifesting your cortisol release. And that is how your cortisol showed up on your body. Right.
So it is a possibility.
It is. It is not a possibility. It is science.
Okay.
Okay.
I want to get into some of the problems that people
Yes.
face and like the triggers and then of course the solutions. But just because we touched on the film industry and you were saying, interviews, do you feel like and we had a podcast recently on what it takes to be a successful female actor in films. And we had a casting director who said that the Gori Chitti girl is still very much in demand. And because this is an industry that you work in, this is an industry that you work in as well. You in terms of skin and you in terms of films and content. Do you encounter in your meetings with people that there is still a bias perhaps towards fair skin?
No, I haven't up until now. But I remember very long ago there was this ad I was to do, and in the contract, not the contract, but the description was fair girls. And I was quite taken aback when I read that, because I was just like, why is this a criteria or bracket that we are looking at to cast a person? Because I actually think that not darker, but wheatish and slightly darker, very, very sexy. I find them very attractive. I find the color also very attractive. So, no, not at a personal level, but years ago I did read this description and I was, I mean, it hits you because you're just like, it's not nice.
No. Yeah. But do you feel like people come to you still with
yes, absolutely. The fact is we are all fighting against racism, so-called, color discrimination. But the underlying fact is that everybody likes a fair skin. Okay, and what now we are educating our patients is it's not about just the color of your skin, it is about the quality of your skin. So we are now moving and telling them it's okay to have, we'll talk about the skin types later, but we say it's okay to have a skin type 4, a skin type 5, which we Indian skin are. It's okay to have a wheatish color, but we want a healthy skin, a skin which glows from within, a skin which is well hydrated, a skin which is even toned, and a skin which is good textured. Now that is a healthy skin and that's a nice skin. So when you say so-called sexy skin, we're talking about these elements in the skin.
Right. That's the narrative now, that these are the things that make you sexy and attractive, is to have all of these desirable qualities and not the color of your skin. In fact, what you were saying, let's talk about it now in terms of the basics of what are the different skin types that actually exist. And you mentioned, where Indian skin is a type 3 or a type 4 skin. So tell us a little bit about the basics.
So basically, in science, we grade the skin type. It's called as a Fitzpatrick scale, which is scale 1 to 6. Okay. The scale 1 to 3 is mainly the Caucasian skin, the white skin. Okay. 4, 5 is usually where we Indians fall, and 6 is a little more darker tone. It all is graded on the terms of how much melanin we have on our skin and how we react to the sun. So a lighter skin would burn, our skin tans, but we also pigment. Okay. So a darker skin or a skin which is good in melanin would protect your skin more, but it is more prone to pigmentation. And that is where sun protection, better skin care from the sun, from skin of our color should look into.
I see. In a little bit of research, the little bit that I did before this podcast, there was a reference to the melanocyte count. And I wanted to ask you firstly what that is, and apparently it's similar across skin types. So then why is it that the Indian skin tone is more prone to pigmentation if it's the same across skin types?
Great. So this is where I come in. I love to ask.
You come in much before.
I love to answer these science-based questions. Melanocyte. What is melanocyte? That's your mother cell in your skin. Okay, and that is producing babies. So what are the babies of melanocyte? Melanin. And melanin is what is giving color to your skin, okay? You're right, melanocyte is constant or the same in all skin colors. It is, number one, the type of melanin that your melanocyte is producing, okay? There are two types. I'll sound a little medical jargons, but they're called as eumelanin and pheomelanin. Basically, one melanin is smaller, one is bigger. We create bigger melanin in our skin, and that's why we have more color. Okay. Our cell factory or melanocyte factory is a little more overactive, and that's why we produce more melanin. In slightest triggers, we produce more melanin, and that's why our skin is a little darker toned.
And this is to protect us because we live in a warmer climate, we're exposed to the sun, and then when we have melanin, it protects us also from things like skin cancer and our skin burning?
Yes. So, melanin is protective, but over melanin can again give rise to hyperpigmentation.
Right.
So, we have to take care of both.
Okay. If I have pigmentation, I do have pigmentation, melasma, the pregnancy mask, how can I treat it? Is there some kind of regimen that I can follow?
Yes, absolutely. Apart from your cleansing, moisturizing, you need to now introduce a treatment cream which ideally would work on your melanin, reduce it. So the latest molecule is thiamidol, which works directly in not only reducing the pigment melanin but also works on reducing the production of pigment.
Right.
Okay, and then of course a anti-pigment sunscreen, which not only has sun protection but some amount of anti-pigment cream as well.
Right. So I think one thing to remember is that these two products must go hand in hand, the sunscreen and the anti-pigmentation serum. And you mentioned Eucerin also. So I think Eucerin, because it has I think it's more than 100 years old as a company, and it's got evidence-based research. And when you're buying a product, so for example, if I've got the Eucerin anti-pigment dual serum, then it has thiamidol, which is what I should be looking for, which is the pharmaceutical component, the drug, that will actually treat the pigmentation, as opposed to a lot of products that claim to treat pigmentation but may not have something that is actually scientifically proven to do so, right?
You get 10 on 10.
Thanks. But it must go hand in hand with the
sun protection.
And their sun's protection, which is also, I think it's a pigment control sunscreen by Eucerin, it also has thiamidol.
Yes.
So lovely. So I think that if you're looking to treat pigmentation, then a regimen that has both of these products is important to have in your skincare regimen.
You're right. Absolutely right there.
And I think sometimes maybe things that are scientifically backed, evidence-based research is always helpful.
Yes.
I think when you're trying to solve a problem. I wanted to ask you this point because I feel like a lot of the things, and when you were talking about the fact that you had this acne breakout for the first time in your 20s, I had rosacea when I was growing up and when I went to university. Of course, even not being on camera, it was not fun. And I would be embarrassed by it and I would wish that it didn't exist. I tried a bunch of things. Over the counter, lots of creams that made my skin burn and then it would peel. And I wasn't really sure. I don't think at that point, I think I was in England, I didn't have access to a dermatologist, so I was doing a lot of this without any backing. And I think I burnt a layer of my skin off, basically. When you dealt with your acne, how did you get rid of it? Are there any other mistakes that you might have made in your 20s? And I'm again thinking of one thing which I never used, sun protection. And I used to love going out in the sun, playing sport, tanning myself. So I would just cover myself, in fact, in an oil that would deepen a tan. And also enjoyed having a darker skin tone. A lot of people feel it's also slimming to have a darker skin tone. Perhaps that was what was motivating me.
I didn't know this.
You don't know this?
No.
Why do you think they use like all kinds of darker,
like a contour
creams? Yeah, contouring.
Yes.
So these are things where I went wrong, and then I actually had terrible pigmentation in my 30s, which then went into, I don't know if it was technically hyperpigmentation, but I had a pregnancy mask after my daughter was born, which I didn't realize was a pregnancy mask, which is what the kind of pigmentation that I had was like a mask, in like patchy. And every time I went into the sun, which is often, we'd go on holidays, it would immediately trigger and it would be apparent and obvious. And that would be hugely distressing for me. It's now seems to have come under control, and I will ask you a little bit later whether this was hormonal, whether this was just the abuse of my skin without sun protection, and all of those things. Pigmentation, nothing that has ever concerned you up until now.
Up until now.
But are there things that you might have done in your 20s that you feel like were mistakes?
Like you said, people use too many things at one point. So when I had acne, because I was so disturbed, I would just keep thopoing multiple creams, or a lot more of it, hoping that this would go away faster. But what actually helped me was stopping everything and moving away to a very basic routine and not doing so much. And that's how it went.
So like do a reset of your skin.
Just a reset, just put everything away. It takes a lot, because you wake up and you look at yourself and you're like, somewhere you feel like there's something wrong with you, because you see, and it was not 1, 2, it was like my entire face had acne. And I was just like, what do I do? How do I combat this? How do I go to work? How do I meet people? Because you have to look your best.
Yeah.
But I just stopped. I stopped doing everything. I just ate well. I took care of my mental health, and that really, really helped me.
I feel like also perhaps because with Anya's case, it's not like something that she had in her teenage years and adolescence. So perhaps it was...
I had like one off,
Yeah.
but not like the kind I showed to you where it's just splattered all across.
Which we'll cut to
So
now. A
this-
picture of to see Anya.
It was really bad, but I want to talk about it because I know a lot of people
Yeah.
have to go through it.
Yes. So in our OPD, that is in our waiting area, now we see more of post-adolescent acne. You were talking about
Yes.
adolescent acne. So maybe around 2 decades back, there was more of adolescent acne that we are dealing with. But now we are seeing more of post-adolescent acne.
Is it
And
called
we are-
adult acne?
It is
that
also
people-
called as adult acne. It's called as acne tada. There are many names to it. Yeah, but they usually start after the age of 19 and 20.
Why though?
And that is more related to lifestyle. So you did bring that up, and it is related to how you eat and how you sleep and how your mental status is, right? And your mental status eventually works on your hormones. And those hormones, so we have receptors on our oil glands. So our hair and oil glands are one unit, and we have a receptor there, which is sensitive to our hormone called as androgen. And all that increases whenever there is stress, and that causes hyperactivity of your oil gland, leading to oil plugs, eventually infection and acne. And typically, you showed me your pictures earlier, you had a lower face acne,
Yes.
and this is your androgen dependent area. So why do we say that adult acne usually comes on the lower face? Because that is where you have maximum receptors to your hormones.
Okay.
So the reason why we were talking a little bit about these sins that we do in our 20s is because they show up a little bit later. So what are some of the more common skincare sins that we might have made in our 20s that will haunt us in our 30s and 40s?
I tell my patients, your skin starts aging from the time you're born. Okay, when you're younger, you have an ability, or your skin has an ability to repair as fast as the damage is happening. Okay, but once you enter your 20s, late 20s, the repair goes down, the damage increases. And that's when you have to start taking a little more care on your skin. The core, like I said, has to be your CMP, your cleansing, your moisturizing, your protection. The early you start, your skin will bless you later, right? It's not an overnight damage that you're looking at, okay? In your 20s and 30s, you'll feel, oh, my skin is fine, I'm doing well just with a cleanser and a moisturizer. But it's the cumulative photo damage, sun damage, that is accumulating in your skin, and it will show up later. It will start showing in your late 30s, in your 40s. Sometimes this pigmentation can be deep down in your dermis. Dermis is your lower layer of the skin. It can be dermal pigmentation, and then that gets very tough to treat. So the faster we start taking care of our skin, you will be preventing hyperpigmentation later.
Right. And what about the habits that people have, as you said, the Korean glass skin, of using actives,
Yes.
compromising your skin barrier?
Yes. So nowadays, because of the trends, people use a lot of actives. They don't realize that the over-the-counter creams are no more like your Pond's and your Charmis cream, which was just a moisturizer, which was absolutely fine. All you were doing was just hydrating your skin. But now, people have a lot of actives in the OTC product, your over-the-counter products, and they are layering one after the other. They're using all kind of AHAs, BHAs, retinols, niacinamides, which they think are fine to use. But they are eventually, these actives are over exfoliating your skin and causing a damage to the barrier of your skin. And that you're opening up your skin to catch more sun, right? And causing more photo damage eventually.
I have a question. because very often when you go to a dermatologist, and touch wood, I've been with mine for 8 years now, but prior to that, whenever I would walk into a dermatologist's office, they'd look at me and they'd be like, they'd write 10 medicines and 10 procedures to like get done, and I'd walk out so overwhelmed and be like, firstly, this is really expensive, how much you're charging me, like 70K for one visit of medication and procedures. I'm just like, this is ridiculous. Number two, I don't want to get all these procedures done to myself,
Like what?
Like they'd be like, oh, before you start aging, you should get a little bit done here, a filler, or like Botox is very good. And I'd just be like, but I have come for a very different conversation. Something as simple as, oh, I just wanted to have my blackheads removed, and you've gone to me having 2-3 rounds of Botox and then doing a filler and then various lasers. There's so many procedures today also. There's a diamond laser, there's a different laser.
And you feel they're selling this to you because you're an actor, or they're doing this with any 20-year-old girl? I feel like it might be with any 20-year-old girl.
I walk out if someone sells so many things to me, because I'm just like, it's not possible that I need so many things.
No, I told you when I went to a dermatologist.
I think it's just a wrong door she's knocked on.
No, but there are many, because I went to a dermatologist in COVID times and I took off my mask and she said, I can't believe you've lived like this for so long.
I know, I met you after this
Probably you all have
visit.
been to the same dermatologist.
No, we went to very different dermatologists.
Okay.
So this active, one thing is that,
Yes.
is this a common practice to suggest things that are beauty treatments or cosmetic enhancements when you're going with a particular skin problem?
Very honestly, in my practice, rather than me writing a list, I'm cutting down on that list. My patients now come with a bag full of products, okay? And they already have so many actives in their bag, in their pouch, okay? So I ask them, okay, let me know what you're doing. And then out of that, I just pick up 3 products. I probably may introduce 1 prescription drug from my end, because prescription drug is what actually will work therapeutically at your cellular level. And that's what we want to do, right? So I basically pick up 3 products. I tell them, use this consistently for it to be effective, and then probably add 1 more. So I think maybe, the dermatologist you're talking with about maybe having a different approach, but usually this is.
I'm just saying, if you generally just walk in, you'd be very overwhelmed, and also you'd go back very underconfident of yourself if someone told you have to get so many things done. I'm just stubborn and I'd be like, no, I'm not.
But that's good, because you also have the self-confidence to push back and say this is not something.
But I'm not your target audience, right? I feel like a lot of, in smaller cities also, people would get carried away because they'd be like, oh, if such and such person has done it, or
I want to look like that.
I want to look like that. And I'll talk about this video, which I maybe should not, but anyway. Very recently, I was at some event and there was this dermatologist, and we were a bunch of people, and they broke down who has done what.
Oh, nice.
And I've done some 5 things to my face. And I looked at it and I said, this is so incorrect, because I've done nothing to my face. But if this dermatologist meets another client and says, oh, but she's also done this, and they're like, oh, I would like to look this way. But he's wrong, because I've done nothing.
Right.
So actually you're very incorrect with your information that you're
passing
passing
on. But you see all
on.
these reels. You see that, person takes, let's call them person A, and says A has done this. And then other people do feel like, okay, this is normalized in some way. And I can also do these things. 2 things you mentioned were something actives, which perhaps you can just decode for somebody who doesn't know what an active is. And you're saying that we're using a lot of actives without realizing that, and that can be damaging. Another thing that I want to touch on was that, we try so many different things, forget procedures, even creams and expensive things. We experiment, and constantly something new is coming into the market. Is that bad? And perhaps there's an argument that says that it is okay to stick to something that has been around for 100 years, that people have been using, that is scientific, that is evidence-based, that may not be fancy-schmancy, but using 1 or 2 simple things, as opposed to trying, because I'll tell you why, because somebody told me in a different context, not skin. Right. In a different context, it's good to keep trying new things. Because today they tell you this is going to work. Tomorrow they say this is bad for you. That happens in, for example, foods. They'll say ghee is good, ghee is bad. So, don't have it for too long, because it might actually not be good for you.
Okay. So first thing, I'm happy that you found your right dermatologist now and you're sticking to her since
It's
the
been
last 8 years.
Very long
So
relationship.
I'm
I've
really
had.
happy about that. So coming back to the questions that you asked me, we are saying, is it good to keep switching to products? So there are certain ingredients which we call as believers of science are gold standard.
Yes.
Okay, where we are talking about pigmentation. Okay, we have a molecule called as hydroquinone, which is a gold standard for pigmentation. And any new molecules that we talk, we always would compare it with that molecule. Right, so you're right, there are age-old molecules. Even for acne, we have age-old molecules like isotretinoin. I'm sure you've
Yes.
used it.
Yes.
Now that's a gold standard, okay. And those other 10 prescription around it may be just to soothe your skin, calm it, work on, you know, maybe your post-inflammatory pigmentation. But your core treatment will be a gold standard treatment, which a doctor would give you.
So is that
right?
what you mean when you say you might prescribe a pharmaceutical component?
Yes. So when I say I would prescribe a pharmaceutical agent, I would prescribe something which has worked for us since many, many years. Yeah? And when we're talking about then newer agents, yes, we are always open to science, to new research, to new molecules. The reason is we are always in a hope that something would work better.
Right.
Everything has a limitation. So we know that certain molecules have its limitation. And we are always open to getting products which can overcome those limitations, right? Now, when I'm talking about a hydroquinone, though I'm saying it's a gold standard, it has a limitation where you can't use it beyond a few number of or few months or weeks, because then it can cause a rebound pigmentation, or it can probably damage your mother cell melanocyte completely.
Oh.
Which we don't want. Answering your second question, whether you need to keep changing your products. Products, when something is working on you, we ask our patients to continue. But what happens after some time is our skin gets used to the same molecule. Okay. So I would tell my patients, why do I call them for a follow-up? I tell them, use it for 3 months, use it for 6 months. Come see me after 6 months. Not because the product I'm giving you is bad. Not because it has stopped, you know, or gives you a side effect. It's just that your skin gets used to it.
Right.
And that's the time you switch the product so that, you know, your skin again will start responding in a better way. Yeah. So it's called as a shock treatment to your skin, right? So that's
like in the gym with muscles.
Yeah.
Yes,
Yes.
Yeah.
Food, workouts, everything.
Everything.
So when one is looking, for example, I first identify the problem. If it's pigmentation, that is something that you are suffering with, and you will tell us why suddenly in India pigmentation is on the rise and has become a concern, and what are the triggers for pigmentation. And you look for the problem, you find a product that will solve that problem, and it should have this pharmaceutical component,
Agent.
like the gold
Yes,
standard.
yes.
And you mentioned 2 of them. You said something is more recent.
Your Eucerin, the brand, has come up with an active called as thiamidol.
Thiamidol, okay.
Okay, so that's the latest in pigmentation. The question is, why is pigmentation on a rise? I don't know whether pigmentation is on a rise, very honestly. It's just the awareness is on a rise,
Okay.
and which is a good thing. We Indians, unlike a Caucasian skin, Fitzpatrick 1, 2, 3,
Yes.
okay, they age more with wrinkles, lines. Okay, we age more with pigmentation. Okay, so pigmentation is been with us from years together. Even if you have to look at your dadis, nannies, grandparents, you know, if you see their younger year picture vis-a-vis their older years, you'll see the skin color changes. They are looking more pigmented, more uneven skin tone.
But
So
if, for example, sorry to interrupt you,
Yes.
like Anya's nanny, like if they have genetically good skin, and did you ever see this happen with your mother or your grandmother?
No, and I was actually thinking of your mum as well.
No, but my mother had.
Yeah?
And in fact, I was chatting with her today before we came on to this podcast, and she was saying, you know, I had a lot of pigmentation.
Yes.
Oh.
And I thought perhaps it's genetic because I had a lot of pigmentation.
So now we are going beyond genetics. We are going to something called as epigenetics. Okay. Epigenetic is on how your cells are changing at a molecular level. Okay, and how you can actually improve your skin longevity. We are all talking about longevity,
Yes.
not just the body,
Yes.
muscle longevity. We are talking about skin longevity. So yes, we aren't saying that the way your skin will behave. That's the reason why they say when you choose a girl, you look at the mother, and that's how you know your wife is going to age, right? And which is so true. Aging is genetic. The way your skin responds to agents is genetic. But now we are going more deeper, and we are talking about epigenetic, which is we're working at the the cellular level.
Okay.
Okay, and that usually, runs in the family, and sometimes epigenetic is also related to your environment.
Yeah.
So it's not just the genes. If you have good genes, of course, that's wow, that's a bonus plus for you, but that doesn't mean that your skin won't pigment. It also depends on your lifestyle,
Yes.
how much exposure you have to extrinsic agent. So intrinsic is internal genes, extrinsic is external. So it also depends on what you're exposed to.
Now my questions are because Anya is here and she says, I don't have pigmentation in the family that I've noticed, and I don't think that I'm putting words in your mouth, but it's not a concern.
Yeah, you're really
I'm not going to pigmentation at all. No, but I mean, like, when I asked you, I said,
no,
do you have
I said
pigmentation as a
my
concern?
family was, my nanny had a very simple routine. That's what I said.
But your nanny may have a simple routine, but see, she also must be having a simple life.
And
that's
your life
where-
is not simple, let's face it.
Yes.
Also the produce that they ate.
Lots of things.
Yes.
So my point is that the reason why I want you to be invested in this conversation
I am very invested. I've learned a
is
lot.
because I feel like in your 30s, things might happen and you should know how to handle it, Anya.
I mean, like she's been through something and she doesn't want me to go through it.
Exactly.
But I also have a question, which is, how does pollution today play? How is it an agent? Does it aid in aging or pigmentation or acne? All these things.
I just want to say I have this question. But thank
No,
you.
I'm asking for myself now.
But I have this question.
Which is
Let's take it
my
up. What's your
concern.
second question?
My second question is, when you have hypersensitive and allergic skin, how do you introduce a new product, and what is a big no-no? Like, you should not be trying this. For me, I think it's like vitamin C that I've been told not to apply.
use, yes,
And that's an active,
yes.
right?
Vitamin C is an active, absolutely. It's antioxidant also, but it's active. I'll come to that. So answering your first question, all your stressors, which is your pollution, smoking, sun, lifestyle, lack of sleep, all of them are causing something called as microinflammation. What is microinflammation? It's like a small little fire happening under your skin, and that over a period of time will produce more pigmentation. It will stimulate more of your mother cell melanocyte, producing more melanin, eventually giving rise to hyperpigmentation. So yes, pollution does eventually, not immediately, but over a period of time. Everything is cumulative that we are talking about, right? So all these stressors of life eventually will give rise to
So
pigmentation.
these are the triggers for pigmentation.
These are
like you
all
said.
triggers. These
Pollution,
are all
sun
triggers.
exposure.
Absolutely.
Hormones also.
Hormones as well.
Hormone
So if I have
imbalance.
to talk a little more in a medical jargon, then I would say there is an enzyme in our skin called as tyrosinase, okay, and your tyrosinase has a receptor to all these agents, okay, and this enzyme eventually goes and triggers your melanocyte, which triggers your melanin production. All right, so these are all triggers
Are
of
there any other triggers we should be
hyperpigmentation.
aware of?
Is sugar also?
Sugar is also a big trigger. So sugar is inflammatory, and like I said, anything which is inflammatory, inflammation, fire, okay, anything which is inflammatory in your skin eventually heals with hyperpigmentation.
I
Okay,
see. Okay.
I don't have a sweet tooth.
so you're lucky.
That's because she said, no, she's seeing my skin become better over the years. I'm just letting her know the reason.
And I have a
Yeah.
big sweet tooth.
So do I.
She doesn't share.
No.
What? Yeah.
Like her cake and stuff. She
See,
doesn't.
it's a good thing because it's not good for you.
Yeah. Oh, you're so
I'm helping you.
And you're not fond of it.
Triggers we talked about, I just wanted to briefly touch on the different forms of pigmentation, if there are, that exist. And again, why Indian skin is more
prone
prone
to
to it.
pigmentation. You know, in our medical school, we had a chapter on hyperpigmentation, and there are 100 different kind of hyperpigmentation. What is significant for, or what is the common ones I'll talk about. I'm not going to touch base on the very medical ones, but the common ones that we encounter, number one, she spoke about pregnancy mask, which is also called as melasma.
Yes.
Okay, so melasma is one of the very common conditions seen in Indian women, and sometimes in men, but 90% or 95% in women, and 5% maybe in men, because it's triggered by estrogen. And estrogen is your hormone which goes a little haywire during pregnancy, during menopause. These are the two decades or 2 phases of your life where you can get melasma. So it's mainly triggered by hormones, and then
And is that
further
estrogen going high, estrogen going low?
estrogen going high, and then it is then further further aggravated by sun and stress.
Right.
Okay, so that's your melasma. Melasma is most common. What else is very common is tanning. Okay, so it's not just superficial tan. Sometimes, like you said, it looks slim and you just look contoured, but tan eventually can turn into deep tanning, and the deep tanning eventually can turn into stubborn pigmentation. So that's again a very common condition. Third very common condition seen in Indian is something called as PDL, pigmentary demarcatory lines. So if you look at women, and now you all should start noticing people around you, you will see that they have pigmentation on the cheek, around the mouth, on the temple, very, very common in Indians. Okay, and these are the 3 most common pigmentary conditions that we come across.
I have like 1 to 3, 10
3, 4
maybe freckles on
freckles. So freckles are a very superficial form of pigmentation.
Are you happy I have pigmentation?
So, but saying that, it is telling you it's high time you start taking care of your skin, at least with sun protection. Because freckles can only increase with time and then they'll become deep and
Have you not done one of those, when you went to some of these scary dermatologists, didn't they make you sit with those machines that tell you what your skin is going to look like in 10 years from now?
So
and it
visual,
shows up,
AI.
It shows you the pigmentation
Yes,
that's
yes.
going to appear in your skin perhaps a decade from now. I'll take you. What are you doing after this?
I'm with my dermatologist. Very honestly.
Freckles, because you touched on it, now people are very into freckles after Alia Bhatt having natural freckles. It's desirable. So I'm saying like your freckles also they're cute. But are there something that one should worry about?
That's what she's saying now.
So,
that now
so
if I
freckles right now look cute, but if you let them be, they'll keep going darker. It is anyways telling you this is all, how do freckles come? They are photo damaged, right?
Right.
So having little is okay, but start taking care because this is photo damage already showing on your skin and it only can worsen from your own.
I have one more, question.
Yes,
So,
yes.
because as actors, we're also in front of a lot of light
Heat.
and heat.
Not just sun exposure, heat
So
is a trigger.
as long, I mean, you wear a lot of layers with makeup. Is that enough to sort of protect your skin from the amount of light?
Not really. So y'all are, yes, not only exposed to the direct UV rays, your indirect UV rays, your lights has visible light that also can give rise to pigmentation. Your blue light from your phone. So if somebody had a history of melasma, you have to be careful. Your blue light, your visible light and your indirect light are also enough triggers to worsen your melasma.
So is a sunscreen good enough to protect you from that kind of light? When
No,
you're
no,
on
wait.
your-
I don't want to come to solutions yet.
Oh.
Solutions will come to
Later.
just now. Before we come to solutions, because I'm assuming sun protection is a huge part of this, but you'll tell us about how to solve this a little bit.
Yes.
I want to ask you because another trigger, are the things that we do, and in India we love ghar ke nuske, we love like home remedies, we love things that we can make in the kitchen
Right.
and solve a lot of our problems. And I feel like sometimes you can, sometimes you can't, and not everything that is made in the kitchen may be good to put on your skin. I feel you're also quite a natural person.
Yes.
Have you tried any home remedies and did any of them work for you? Did any of them not work for you?
Again, I've had to keep it very basic because I never know what I'm going to react to. So what I have tried is dahi with a little bit of besan and haldi, a tinge of honey, and you put it. Lemon burns my skin, so I never really add lemon, but there are recipes where people add lemon. And I remember once I was stuck and I really wanted to scrub my face. So you know those Nescafe, these sachets?
Coffee granules.
Yeah. So coffee and a little bit of sugar and you mix it and then you just scrub your
Exfoliate.
face. Exfoliate.
And did that go well for you?
Yeah. It was before one of my events and I was just stuck and I was like, I really want to like get a nice scrub in.
Yeah.
So I just, whatever was there, just used those 2 things and I did it. And ice.
Yes.
Ice. I ice my face, but not on a daily basis, but whenever I have shoot, I do ice my face. I think it really like wakes my skin up.
Yeah, and these are things a lot of people are doing now.
Yeah.
They're putting their face nice, but I understand also ice can burn.
Yeah, so
coffee can-
I agree to disagree with everything that you all have spoken.
Oops.
Okay.
You have spoken. I've not said anything. I just
Would
asked
you
the question.
disagree that once I went up
So
to my terrace?
I'll tell you, you go to your kitchen, a good thing, but eat what you have in your kitchen. Okay. Don't put it on your skin. Your kitchen stuff is to consume, not to apply. Okay.
Ever?
But isn't it what you eat
Ever.
shows up on your skin?
So
But
eat it. You have your vitamins in your food, and those vitamins will never ever penetrate your skin. You have to understand your skin has a barrier which will not allow anything in your food to enter. Okay, your basin is good enough because it's just a gentle cleanser, but apart from that, there's nothing in the kitchen which is going to help. It may just destroy your barrier. Okay, so so kitchen remedies are complete no-no. Cold plunges, putting your face in. I was seeing that all over Insta for a very long time. What you call wakening up your skin. So when you're doing a little cold compress, it does temporarily reduce your edema, your swelling. It improves the blood flow, which is okay. But you also have to remember, if you're doing excessive cold therapy, causing again inflammation, micro-inflammation, long-term. See, these things don't come up immediately. You're looking fine, and then after 5 years, 10 years, you'll go to your dermat and tell her, bye, I've developed pigmentation, not even knowing that you're doing your ice therapy daily.
So if I wake up, if I use a gua sha, is that good or is that?
Gua sha is fun, but I don't know whether it's good. Okay, you are probably a little bit improving your blood circulation, but don't expect too much out of it.
No, because I'll tell you what, I actually wake up super puffy. I'm not one of those who like wakes up and looks amazing. Shocking. But I wake up very puffy.
Over, you look lovely.
No, I don't. I wake up quite puffy, which is why I feel like that little bit of a ice
So
therapy.
instead of doing ice therapy, you could maybe use cold water.
Just cold water.
Just cold water. Splash a lot of cold water. Don't subject your skin to anything which is harsh or extreme.
Okay.
Okay, I think we're scared enough to come to the solutions now.
Okay.
A little bit about the fact that I'm in my 40s. I did all of the icing, I did all of the not wearing sunscreen, I did all of the actives, I had the pregnancy mask, I had the pigmentation as a result of that. I feel like now perhaps it's come under control. One question, can it come back? A second question, how do we treat the pigmentation in a way that is sustained? I'm assuming sunscreen is a part of this.
Yes. Now, I'm specifically talking about your pigmentation to begin with, melasma, you know. So, I usually use this quote for my patients. When the world comes to an end, two things which will never go, cockroach and melasma. Did you get your answer there? So, basically, certain kind of pigmentation are chronic. Okay. And whatever treatment we are giving, we're doing it to control it, not to cure it.
Right.
So maintenance is a must. You have to understand, you know, there is a factory, your melanocytes have a memory, they have been activated. They are going to now produce a melanin with the slightest trigger. Okay, a little trigger for you is enough to bring your melasma
it's
back.
True. So even if I go into the sun for a fraction of time, everything comes to the surface.
Yes. It's very similar to your allergy. Your allergy will start maybe in a smaller scale, lighter to begin with, but every time you're exposed to that particular allergen, it will keep becoming stronger and stronger. So the same rule applies to our pigment cells. You know, they have a memory, and once that memory comes in, a slightest of stressor is enough to activate them. So you have to get more and more active where you're using your moisturizers, your sunscreen and your actives. And when we're talking about actives, we are saying start with a basic. So we spoke about CMP and now your T comes in. So cleansing, moisturizing, treating and protecting. Okay. So whenever you already have some damage coming in, and that is where your therapeutic agent comes in. Now photoprotection. So your sunscreens, let's put it this way, if somebody like her who yet doesn't have pigmentation, she can use a SPF, broad spectrum of course, every time you're using a sunscreen. Now we have very good sunscreen which are broad spectrum. When we say broad spectrum, it is protecting us from ultraviolet A, ultraviolet B, infrared, visible light, all of it, okay. You can start with a lower SPF of 30 to 50. Okay, but when we're talking about her, because she already has pigmentation, she already has photodermatosis. Photodermatosis are conditions which are caused because of sun. Now, if you already have that, you have to up your game with your sunscreen.
So you have 50?
There is 100 also.
Really?
Okay, so you start using higher SPF so that you get a little better protection. I'm not saying by increasing your SPF, your protection will become twofold, but at least it will be better than a 50. So you start using a SPF of 80, 100, okay. Again, most of the time where patients go wrong is when they have a sunscreen on, they always have the false feel of protection. They feel they are protected, they have a sunscreen. So my patients come and tell me, but I used my sunscreen, doctor, I still got pigmented, I still got tanned. Your sunscreen is only giving you a 40 to 50% protection. Again, let me tell you what is the ideal way of using a sunscreen, which nobody can use because it is not practical. So one is ideal, one is practical. Okay, what is the ideal? You use 2 finger units and you use it every 2 hours, which is not practical. Okay, so anyways we are underdoing it.
Do you reapply your sunscreen through the day? You just
So
apply it
nobody
once.
does it. Nobody does it. You don't have to feel bad. None of my patients do it. So I know that. I know that. So I tell them that, you know, by you introducing a sunscreen, don't think you are protected. You're still damaging your skin, but maybe a little lesser. The best way of protecting your skin from sun is not to go out in the sun. Okay, when you're out in the sun, walk in the shade. Start using physical protection. Like you said, you don't want to spend 10,000 whatever blah blah amount every single time you're going to your dermat. Start using physical protection, your clothing, your cap. I tell my patient every single time, start using umbrella. There's nothing to feel, you know, weird about or strange about using umbrella. Umbrella is forming your own shade. And then additionally you put a sunscreen. Okay,
But
so
then don't they also say your body needs to take some sun?
Vitamin D.
Yeah.
Oh, now that again is a big thing. Every patient would come and tell me, oh, you have enough sun in your country to give you vitamin D. And anyways, your vitamin D, you can just take 1 pill once a month, which is enough to give you the supplement of vitamin D, rather than subjecting your skin and body to so much of UV radiation, which is eventually so damaging at a cellular level.
Okay.
Okay. You rather just take 1 supplement of vitamin D.
I have a question. Can I ask?
You ask me the question, I'll ask you.
Okay. You know those, now people use those light masks.
Red light.
Yes, red light, blue light.
Yes.
Are those beneficial in any way?
Have you used these red light and blue
No, I
light
haven't.
masks?
But
Are you
should I
considering
start?
using them?
Yeah.
Um,
If I'm told that they're beneficial, then
Are they going to help with pigmentation?
Again, a big fad, na? LED lights, they are trending right now. Like I said, everything trending is not science, okay? LED light to some bit helps in improving your circulation, your blood circulation. They're not that powerful. Your home care LED light are not that powerful. We don't have any studies done on LED light. They're just trending on Insta. So if you ask me as a doctor, can I tell you whether they're good or bad? I have no answers because there's no study done on it. And we practice evidence-based science. So till we don't have published data on how it is benefiting over a long period of time, we will not be able to tell you.
Wanted to ask you because again, in my 20s, I experimented a lot, and if you looked at my bathroom cabinet, it had a bunch of stuff in it. You've already said that you're much simpler.
Yes.
I feel like most people perhaps should, from their 20s to their 30s and certainly in their 40s, which I'm in now, simplify their skincare routine. It's always that golden rule of cleansing and hydrating and protection should exist. But perhaps in your 30s, have you felt that you've simplified your skincare regimen? In what, like I'm saying that for people who are in their 30s now and were in their 20s, what are the things they can get rid of and how can they simplify and focus on things?
So can I answer that?
Yes, please.
And then looking a little less. It's not about simplification. It's about picking up the right product. So when your skin changes with age, your products change.
Right.
You know, the way you mentioned your products change when you travel.
Yes.
So it's not just the weather, it's also the age of your skin, right? So when you're young, you could try starting with a basic antioxidant like a vitamin C or maybe, you know, any topical vitamins that you wish to. And then you can maybe introduce a mild retinol in the beginning. But as your skin gets older and more matured, then you up the concentration of your retinol. You can then move to pharmaceutical tretinoins. You know, you then start introducing more of peptides, more of hyaluronic acid, maybe more of AHAs, BHAs.
Right.
So it can be still simple, but with the right ingredients. So it can be still 3 steps, but those 3 steps have to be in the right direction. So everything in our body goes to degeneration, right? Each and every cell in your body, and that's how you age. You know, your nature doesn't want you to live beyond menopause. That's it. And after that, degradation happens, and so does your collagen, your elastin, your HAs. All your cells in your skin is degrading, and that's when you start feeling that your skin is now more sensitive to the sun. Your skin is now, you know, more puffy because your blood flow is becoming sluggish. Everything slows down as we age. Okay, and that's exactly what you're feeling.
One skincare rule that you swear by, perhaps that is very important to you, and after this episode, I want to ask you, are you excited about your 40s?
I'm so excited after hearing all your concerns. I can't wait to get there.
Now, I'm saying now that you're armed and prepared for your 40s, and what's going to hit you?
One skincare rule, I think it would definitely be cleansing, because we wear a lot of makeup on days of shoot. And just that feeling when it goes off, I feel so light. I enjoy it. So I think that's...
So you're saying there are not days where you just fall asleep with your makeup on?
Never.
Really?
Never. I know you do, by the way. I want to put this out there. With her eyeliner and her mascara.
No, just my eyeliner and my mascara. I cleanse my face thoroughly.
That's what I said, with your eyeliner and your mascara. But so she leaves that and she'll wake up in the morning and I'll see her and I'm just like, what happened? But she's quite used to it. I can't do it. Yeah. My skin has to just be, I have to feel hydrated. Like my skin has to feel hydrated before I go to sleep and clean. I just can't.
Which is the right way.
Which is of course the right way. And I've started now taking off my mascara.
Bit late, I'll say.
Yeah,
slightly late.
It's never too late.
It's never too late. Doctor, one rule perhaps, or habit that everyone should start immediately, and one habit that they should stop immediately.
One habit, I would say, start being consistent with whatever you're doing. Just start being consistent. Give your skin time to respond, because that's the way it goes.
And how much time should it respond in? You know, if somebody tries a product, even if I get an anti-pigmentation cream, how long does it take for me to see the effects?
So I would say minimum a few weeks, 4 to 6 weeks to begin with, and then it will just keep getting better. So it all depends on how much you are protecting, and then you are, treating. Couple of weeks for sure, and it will only get better from there. Okay.
And one thing that they should stop doing.
One thing that they should stop doing. Well, I think they should stop looking at quick fixes and embrace long-term management with their skin.
Yeah. Okay, lovely. Thank you. I think that often we get overwhelmed and we feel like if we try a number of things, then perhaps our skin will respond differently, and change is always exciting.
Yes.
But I think perhaps when it comes to skincare, at least the takeaway for me has been that something that has existed for a while, that is scientific, that is evidence-based, is sometimes a good refuge, and be consistent. And sometimes it's only a couple of products that you need.
The right products.
And that's a truth that has existed from, your Nani's time and my Nani's time, and will continue to exist. And perhaps that's why it's so consistent and works so well. So thank you both for being on this episode.
Thank you.
I'm going to ask you some tests now. Okay. Just like it's a myth busting round at the end, just to see if you were paying attention.
Oh God.
This is only
Rapid
for you.
fire.
Okay.
Rapid fire.
You will help me.
Yes, always.
Number 1, natural means that it's safe, like lemon, apple cider vinegar.
No. I must consume my food, not apply it.
Well done. Okay. If it's burning on your skin, it means it's working.
We never spoke about this, but I don't think so.
Yeah. So that's
this was
not
just,
true.
I think when I was talking about how I used various things on my skin and I burnt
like when
a
I
layer off.
bleached my
So
skin.
when
And you
it's
didn't talk
burning,
about it
when
actually
it's burning, it's causing inflammation, and when it's causing inflammation, it will cause pigmentation.
Yeah. Okay.
So
So
no.
don't. If your skin is burning, that's not a good thing.
Yes.
Fairness creams can cure pigmentation.
No.
Yeah. So fairness cream depends on the ingredients.
Oh, it can?
No, it depends on what it has, right?
Okay, so that's good to know. Once pigmentation is gone, it won't come back.
No, it can come back.
Very good.
Waxing and threading cause pigmentation.
We never had this
No,
conversation.
but I'm just asking whether you know this or not.
You can logically think
No, it
about
doesn't.
It's damaging your skin, isn't it? Waxing and threading? And
I
any
don't
kind
think
of
it causes
damaging causes inflammation, which causes...
pigmentation.
It cannot
Can
cause,
burn your
it
skin
can burn
or
your skin,
something.
and burn eventually can cause pigmentation.
So everything
not
can cause
directly,
pigmentation.
not
So if it's done
directly.
properly, then
if it is
then
done
may not.
properly, yes.
And laser?
Laser also, if it's done properly with the US FDA approved machine, which is safe, It will not.
Okay.
And you don't need sunscreen indoors or on cloudy days.
No, you do. All the
Right.
time. Every day.
Okay.
Every 2 hours. That much. That much sunscreen.
Okay, well done. So thank you both for being on the show, and we have a little something for the both of you actually, which is from Eucerin, because we're talking about scientifically backed and evidence-based research. So I think that you should start using this, so that you can look after your skin in your early 30s to keep you set for your. And this is for you,
so
doctor.
much.
Thank you both for being on the show and for just sharing. With
And
everyone
thank
as
you
well.
for being such a lovely host.
Thank you very much. I did my best.
Thank you, Eucerin, for our presence.
You're very
Yes.
welcome. Thank you, guys.
Thank
Now
you.
can go. Bye. I think what has really stayed with me from this conversation is that skincare is not just about doing more. It's about doing what is actually right for your skin, and also, like the doctor said, doing it consistently. So we often think we need to fix everything overnight, a quick fix. But sometimes it's about understanding what went wrong and gently resetting. I want to give a big thank you to Anya for, again, being so honest about her journey, and of course to Dr. Modi for just breaking this down in a way that I think actually makes sense to all of us. I think the real takeaway is moving away from confusion and trends and moving towards more informed, science-backed choices for our skin. And thank you, of course, to Eucerin for supporting this conversation and for bringing focus back to dermatologist-led, research-driven skincare, especially when it comes to concerns like pigmentation. And I really hope that this has helped you at home pause, rethink, and approach your skincare a little more mindfully. And thank you, of course, to all of you for continuing to watch All About Her. Until next time, stay informed, stay healthy, and we will see you in the next episode.